Welcome to the Brain Health Hookup. I'm Laurel Myers Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it. Well. That's a deep subject. I think that this health literacy series is going to be an astounding success. After even one episode, I heard an outcry about one particular expression I used in the first podcast about prior authorizations for medication. And that is, what constitutes a failed medication trial? I even mentioned the fact that it's very common for healthcare providers to say, here's this prescription for this medication. See me in a month and tell me how you like it. And I've heard patients numerous times saying, what's to like about it? I don't even know what that means. So I would hope that when a patient is prescribed a medication, they understand, one, the risks of taking it, what might change about their body that would be adverse, what the benefits might be, what would change about their body that they would appreciate, and what is the risk of not taking any medication at all, as well as what the alternatives are for that medication. So that's an informed consent, in my opinion, is to have the choice and the freedom and the total lack of coercion to say, these are the safe paths ahead. Which one resonates with you as a patient? Or do you need me to use my best judgment and pick for you? That's also a legitimate choice. But at the end of the day, what is a failed trial? If you agree with the provider, you're going to take the medication, you pick it up from the pharmacy and you take it XYZ number of days. Well, these are the guidelines I give to my patients. They're very cut and dried. So this is going to be a fairly short podcast. One thing about a failed trial is that intolerable side effects are not going to suit continuing the medication. If at any point you have intolerable side effects, meaning you can't sleep, you can't work, you can't take care of yourself on the medication, that's a failed trial. Now, there are some things outside this realm. We're talking about psychiatric care here, where the point is to help you function better. There are some curative paths that may be sidelining. So this failed trial concept is not the same for every type of medication or every field of healthcare, right? In cancer care, we may take medications that certainly would impede function and be quite intolerable. Those are a separate set of guidelines entirely. But for psychiatric care, the standard for me and for my patients is, if you have intolerable side effects, such a bad headache, such bad nausea, such bad weakness, such bad feeling of anxiety or sleeplessness, restlessness, that you can't do what you normally need to do in a day, that's a failed trial. There are enough different medications that I don't think we have to shoehorn you into one particular medication that may feel outrageously miserable from the onset. Now, that said, everybody has a different level of tolerance. Some people don't like to be mildly inconvenienced by the onset of a new medication. And we're talking about psychiatric medications here. They're supposed to be neuroactive, right? They're supposed to be neuroactive. So they might feel a little funny. You might feel a little lightheaded or like, that's different. Or you might feel a little queasy. You might feel a little restless or a little bit more difficult to fall asleep or stay asleep. But will it make it impossible to do the things you need to do in a day? Hopefully not. If you have mild adverse effects from a medication, I really hope those go away within 3 to 5 days. If they go away within 7 to 10 days, that might also be okay. But if you have mild side effects that last more than 21 days, is this medication really going to be something you want to hang your recovery on? Are you really going to want to stick with it long enough to come into remission? I would say probably not. So if side effects are transient, meaning they're mild and they last 3 to 21 days, so be it. Then you're going to, see if the medication's effective or not. If they are mild side effects are not transient, meaning they last more than 10 to 21 days, I'm going to say, let's try something else. Unless you have been through quite a number of medications and nothing has been satisfactory. Now, there's one third case in which a medication might fail a trial. So the first is intolerable side effects. The second is non-transient side effects. The third is the medication doesn't work. That you won't know until 6 to even 14 to 16 weeks of taking the medicine, depending on what it is. Some medications are notoriously slow starters. I try to ensure patients take a medication routinely, meaning every single day for at least 1 month if they have tolerable and transient side effects. And if everything appears to be going well at that 4-week mark, to move on toward that longer trial of 6 to 14 to 16 weeks, depending on the requirements of the medication. But there is a point at which, even if you have no side effects, if you're at a therapeutic dose of the medicine, meaning the dose is high enough, and you really aren't seeing a change in the list of symptoms, remember, we're always comparing where you are on the medication to the list of symptoms you started with and see how many we can knock off the list. If we don't see a significant benefit into that list of symptoms, it's going to be a failed trial. And you will either need to take a different route to treatment or a different medication. This is where the number needed to treat we talked about in the first health literacy podcast comes in handy. If you need to listen to that episode, go back and listen to it. We'll link it in the show notes. But this is where the number needed to treat is helpful. If you know your medicine only has a 1 in 4 chance of bringing you to remission or 1 in 9 chance of bringing you into remission, you don't have to guess. If you don't notice a difference in the symptoms you were experiencing at the induction of the medication, it's a failed trial. There's no reason to stay on a medication for 18 months or 10 years just because your provider said it might help. If you don't see a difference in the list of symptoms that you had when you started the medicine, that's why we check those lists, then it's a failed trial. Some patients go through several failed trials. It can be very frustrating, demoralizing, can make you feel hopeless, can make you lose confidence in psychiatric care, and can really change the landscape around you as far as seeing a brighter day, the possibility for a brighter day. I get that. I have the most empathy for that situation. In those cases, I just want to put a bug in your ear, as it were, for an innovation for prescribing based upon pharmacogenomic testing. Pharmacogenomic testing examines the genetic code you have available to instruct your liver primarily in digesting your medication. Most medications go through the liver. The liver has to have certain enzymes to work the way the manufacturer expects. And if you don't happen to have those enzymes, you may digest those medications much more slowly or much more rapidly than other patients. So you may need so much of the medication to get any effect that you actually have side effects from the medication, or you may need far less of the medication to get a strong effect from it. So if you have been through a few different medication trials, or if you'd really like to be very well informed before you start a medication trial, pharmacogenomic testing can be the way to understand that. There is still some debate about the efficacy of these methods. In my practice, I've usually seen us able to hone in on a medication that works in 1 to 2 trials rather than what patients had explained to me as 5 to 7 past failed trials. So it is not a fail-safe or foolproof way to find a medication that works. We're only learning from this test whether you digest the medication as the manufacturer expects or as a manufacturer does not expect. That doesn't necessarily guarantee you'll be one of the NTT patients, that you'll be one of the 1-4 or 1 to 14 that does work for. It only means that you have as good a chance as anybody else. So you would fit into that NTT data set, that structure of how many people are likely to go into remission on the medication as the manufacturer expects. The manufacturer never expects everyone who takes their medicine to get better. They have data on how many people who try it do get somewhat better, at least better than the dummy pill, the placebo, and how many people tend to go into remission when they take the medication. That's the best we can hope for. That's why I'm an integrative provider, right? I'm looking for all the ways we can help, from tuning your nervous system, nourishing your nervous system, healing the trauma that's wounded your nervous system, and reducing inflammation so your nervous system works better. It's part of a whole system of psychoneuroimmunology that I'm fascinated by client presentations every single day. I hope this second podcast in the health literacy series helped you out. What is a failed trial? I hope that at least in psychiatric care, it helps you ask the right questions for your provider so you don't linger somewhere in no man's land wondering whether your medication is right for you or not. As always, I am a psychiatric nurse practitioner, but I am not your psychiatric nurse practitioner. So take all of this information and talk to your own provider about it. And I'd love to answer any further questions you have about terminology I've used today or any of the big concepts that we talked about in this podcast. Thank you so much. Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast, as it helps this show grow to reach more people who need to make mental wellness fun. You can find the leave a review button, as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.